This is a look at WIM's Universal Data Hub, an online healthcare provider and practice directory. The system is used by healthcare facilities, medical associations, workforce researchers, state agencies, and insurance professionals for a variety of provider data needs. WIM works to maintain an accurate and comprehensive listing of providers in Wyoming, Idaho, and Montana, and to make this data useful through our online data hub. The system is accessed online. You'll be giving a username and password. Once you are authorized, you'll come to our home screen. This will immediately show you our provider and practice movement log. So for example, I can come here and see that Kelly Schmidt just moved into Kalispell, Montana, into the Neuroscience and Spine Neurosurgery Center. And here's her NPI number. I can download this data. It's going to give me the last 120 days worth of movement within these 3 states. Any blue link that you see in the system is going to be clickable. So I can click here on her name and it will take me to her provider profile page. It will give me her provider details along with her practice details. If she has any former or secondary practice locations, those will appear here as well too. Again, blue links are clickable. I can click here on the Neuroscience and Spine Center link and it will take me to a practice details page. So here I will have the practice information and along with a list of the other providers that are associated to that practice. Again, I can download that data into Excel, or I can come through and click on another blue link and that will take me to this provider's specific profile page. Again, I can see if there are any former or secondary locations will be here. So very easy to navigate through the system through the different links. Up here on the provider search button, we'll be able to query the WIM database. I can search by first name, last name, NPI, or the name of the practice. I can also search by health system. For example, Billings Clinic has many different locations. Instead of going through and trying to find all of those locations, I'll just come down to health system and click on Billings Clinic, and it will give me all those providers associated to a Billings Clinic location. I can narrow my search down by providers practicing specialty, the type of provider they are. Do I want physicians and physician assistants? Or by their nature of practice. Are they at an independent practice? Are they employed by a health system? Also, practice county and practice city. I will go ahead and just search by health system Billings Clinic and see what those results look like. I'm given a list here of all of the providers that are associated with a Billings Clinic location. I can see their specialty, the type of provider that they are, and which Billings Clinic location they're at. We're given the mailing address here in this list of results so that I can download the data and send out a mailing. I can also click here to print mailing labels to send out a mailing that way. So here I can see the list of all of these providers. There's 445 that I have associated to any Billings Clinic location. I can scroll through the results down here, or I can simply click here on the details page and it's going to take me to that provider's specific profile again. So here we're beginning to add medical education to the profiles of these providers. For example, we can see here where this provider was a medical student and a resident. And that information will begin to flow in for users. Now, if I'm using this as a CRM, I could come in here and create a history note. Let's say that I sent an email about a certain medical form. I could go ahead and hit submit into this profile, and we can begin to track history notes within a profile. So if you have multiple users set up with your system, it's going to automatically submit them as the person. So it's a great way to track your internal communications. I can also schedule myself a reminder if I wanted to follow up on that email. The system's already going to know that it's Jenna Smith. I just select the date and what I need to follow up on. Hit submit. And I have an activity scheduled for myself next week. So I can go to the home page and I can search for my activities. These are all of the users that are associated with my account. I'm just going to go ahead and hit search Jenna Smith activities. And here I have a list of follow-ups that I need to complete, the date and the name. And again, a blue clickable link, so I can just begin working through my activities. Click on that link and it's going to take me to that provider's profile page. I can see any past history notes that have been made, so I know exactly what I need to do what I need to, and create a history note. So that's how the system works as a CRM, where you can track your internal communications, when you're sending out mailings, when you're sending out emails, and keep track of who's doing what. Again, I can search here on the practices screen. I can search Idaho, Montana, or Wyoming, physical city, physical county, and again, practice name, health system. So example, if I wanted a list of pediatric clinics in Idaho and Montana, I click through and here is a listing of those. I can sort by state, I can sort by city, and again, I can download that data. So that's a look at the Datahub's directory and CRM portion. Next, we can utilize the reports if we are creating a presentation or a workforce assessment. It's a great way to easily come in here, see how many providers are practicing in the state, where they're practicing, and what their specialties are. This custom filters report allows you to select by county and type of provider. But just for example, let's select physician assistants, leave county blank, and let's look at internal medicine and family medicine. So based on my filters, I can see here, I now have a report of all of the physician assistants in each Montana county and how many providers there are. So if I open up the county, I'll see the physician assistants, and then I'll see the specialties that I selected. If I click on that, it's actually going to tell me who are those two physician assistants that the report is counting. Just a quick view provider's account. If I wanted to easily come in here and look at the listing of physicians, we have 2145 practicing in Montana, but I can narrow that down by specialty if I wanted to know how many emergency medicine docs there are, or internal medicine. I can just easily come in here on a daily basis and take a look. Lastly, we have the GIS mapper. So this is going to allow us to create a nice visual for a presentation, social media, or report. And it's going to do all the work for us. So this map here is of Montana. Wyoming and Idaho will be added here in January. Let's say if I wanted to look at the advanced practice nurses in the state, this map is just going to go ahead and do all that for us, plot them based on county. I could narrow that down by specialty as well. If I was just looking at family medicine, APRNs, the system does all the work for you. And you can easily come here, download that. You can even share it onto your website and allow this exact model of a GIS mapper to be on your website for your website visitors. There are 4 other reports to take a look at. You can map by primary specialty, secondary specialty, and then a couple of pie charts. So there's a free trial available. So go ahead and if you're on the WIM homepage, just click on any button that says free trial. And you'll just fill out a short form. You'll receive an email. Click on that to verify your email address, and then you're off and running. You can start here in just a few minutes.